I think what's so amazing about pharmacy today is the variety out there of all of the specialties and other, occupations you can fit yourself into as a pharmacist. I'm Mary Kuzel. I'm an ambulatory care pharmacist at the Greenwood Clinic, University of Utah Healthcare. I am their ambulatory care clinical pharmacist. So ambulatory care pharmacy is really team-based care. So it's working with the providers, the nurses, the social workers, the nurse care managers for really our most vulnerable patients that have barriers to improving their health that include medication management. There's so many barriers out there that it's just really exciting to be able to help people better help themselves and better manage their disease. So what influenced me to look at pharmacy as a career is when I was finishing my second year at a liberal arts college with a degree in chemistry biology and thinking about what I want to teach, what I want to go into research, and at that time neither one of those options sounded like the path I would want to take. So I reached out to my Aunt Kathy, who is a pharmacist, who was a retail pharmacist at the time. And I know she'd had a variety of jobs and she just seemed to love her life, love her job and loved what she did. The other appealing part of it was that as a younger woman looking at being married, having children, that the fact that you could work part-time when your children were small and then work into going back to full-time at another time if that was the right time for you to do it just sounded like a good option. So I enrolled in the College of Pharmacy and that was a great decision. There are so many things that I love about this job. I love the people that I work with. I love the opportunity to work with patients who really are so appreciative of the help that we can give them. And I love seeing outcomes. I love seeing people with poorly treated diabetes return to well-treated, well-controlled diabetes and be able to enjoy the things that they really want to do out of life. They're not so tired, they're not so hungry, they're not so thirsty. I also like the fact that with asthma we're able to help those kids return to normal daily activities and not be restricted. Pharmacy is so different today than it was back in 1981 when I first became a registered pharmacist. Now there are specialties that you can go into. You can go into oncology, you can go into pulmonology, rheumatology. Ambulatory care, which I'm a member of, is also a board certified specialty. There are hospital positions that are varied. People work in transitions of care, helping people from make that transition from the hospital to home or from a nursing home to home. There are nursing home pharmacists. There are pharmacists that work in group homes. There's pharmacists that work in industry. There are pharmacists that work in the field of publishing medical literature. There's just so much diversity out there and so much opportunity to explore that you can just reinvent yourself every few years if it's what you decide you want to do.